I'd now like to introduce Dr. Hamish Stedman. You've heard him mentioned earlier on. He is the chair of NHS Salford, and very much an integral part of the partnership that is NHS Salford and of the GP Commissioning Consortium. Ladies and gentlemen, would you please welcome Dr. Hamish Stedman.
Evening everyone, can you hear me? Sorry for the croaky voice. For those who don't know me, I'm Hamish Stedman. I've been a GP in Salford for 30 odd years. I've lived in the city since 1979, working in hospitals before being a GP. And my remit tonight is to talk about the future. You've heard from Alan et al. Of the huge changes that are coming to the city and to the health service in general. And my remit, as I say, is the future. Excuse me while I just work this out. Wrong way. And my remit falls to me because I'm chair of Hamish Salford, which is a clinical commissioning group, an organisation that has been set up in response to the health service reforms. Before I look to the future, I think we have to look to the past. And I suppose I have a number of themes to talk through tonight. Relationships. Relationships between clinicians. Relationships between clinicians and managers. Relationships between organisations. Trust that ensues from those relationships. Respect that develops. And therefore partnerships that can deliver things that otherwise will not work. And the biggest partnership that I think we have to build in Salford is with our population. I think we cannot fail in that respect, because if we do, all we aspire to in Salford will not come to fruition. So briefly, I will go back over how we've got to where we are in Salford. Those of you who were at this meeting in 2006 at Salford Quays will remember Elaine Tamkin launching PBC, practice-based commissioning. Again, Salford, a very forward-thinking PCT, embraced this with gusto. This saw the city divided into 8 clusters, or as we now call them, neighbourhoods, of GPs nested together. Each GP practice being given an allocated notional budget for purchasing or commissioning the care of their patients. This was certainly the first time in my professional lifetime, I would think of most GPs' lifetime, but we actually started to understand the cost of care and managed to actually evaluate whether the cost of care delivered good quality, good effectiveness and value for money, which Andy discussed earlier. And this was very successful, but it soon became clear by 2007 that you couldn't really have 8 clusters of GPs working independently. You couldn't realistically have 8 pathways of care for diabetes. So the GP fraternity in Salford, I say fraternity, sorry Elaine, sorority, got together and decided to pool the entire budget. That also meant responsibility for all commissioning came to GPs. It also meant GPs had to be mutually accountable to each other. So a GP in Earlham could scrutinise a GP like me in Swinton, scrutinise a GP in Lower Broughton, and say, you're spending too much. That means there's less money for my patients. Now I say spending too much, this was notional budgets, and there still are notional budgets. I don't have a cheque we can go out and sign that, Andy still does that, so this is still very notional money. But the brave new world will see GPs taking over and actually having the real budget. Clearly, we couldn't just do this overnight though as a consortium. There had to be a timeline, a pathway. And there was a 5-year development plan envisaged, which saw GPs taking more and more responsibility for commissioning. And at that time, it was envisaged that more and more staff from the PCT would move over to a GP organisation. And at year 5, there would be a separate GP organisation, a commissioning organisation, working alongside a much more shrunken PCT from whom the staff had moved. And that was going very, very well until last year. Equity and excellence liberating the health service. And suddenly, Salford PBC consortium was not going to just be a commissioning organisation in 2013, because our timelines met 2013. We're now going to have to assume a large raft of responsibilities currently undertaken by the PCT. So, now this is a busy slide. I'm afraid it's actually a little bit turgid, but for the people of Salford, it is very, very important that you understand these are the domains that Hamish Health Salford will have to achieve to get authorisation to prove to the government, but most of all to the people of Salford, that we have the competencies to take over from the PCT come April 2013. The first domain, professional and clinical focus. It has to add value. To my mind, that is a no-brainer. You have to have clinicians aligned with commission decisions, otherwise things don't work. Quite clearly, in other PCTs, this doesn't always happen. Quite clearly, there are other PCTs that are failing. And one has to ask the question, and Mike Burrows has said it many times, that PCTs have been judged by the worst, not by the best. We have a very, very good PCT in Salford. So this is not a difficult position for us. We're doing this with the PCT and have done so for the last 4 or 5 years. Engagement with patients, carers and their communities. And the word I haven't put on there, meaningful. This has not got to be trite, a soundbite. No decision about me without me has got to mean something. And I'll come back to that towards the end of my presentation, because we really have to start engaging with our public to get some real dialogue and to understand what they want and what we can deliver from the health service. Clear and credible plans. We have to deliver on QUIP, quality, innovation, prevention, productivity. Almost struggled there for the last one. We have to live within our means. We do this and have been doing this with the PCT for the last 5 years. Our challenge is now gathering a portfolio of evidence to actually demonstrate that. And that will be a bigger burden than actually doing the job. Constitutional and governance arrangements. Well, the current PBC, or the previous PBC consortium had allocated to it 70% of Salford's £500 million spend. Clearly, Alan and Andy are part of that. Claire wouldn't do that without some kind of proper agreement. And the inter-practice agreement that was the foundation of the PBC consortium was a fantastic basis for doing just that. And we're building on that and getting our governance such that it can be completely open and transparent. You cannot expect the government to hand over all that money to a new organisation with clear processes in place, transparency, how the money is spent, where it's spent, decision making. Collaborative arrangements for commissioning. They're already happening. There is great partnership work with the local authority. We have to work with other CCGs, and we'll have to work with what is called the NHS Commissioning Board, which will come into being at the end of this year for for specialist commissioning services. And finally, develop individual and collective leadership. Well, I suppose I'll be assessed about that. But in truth, there are 30 GPs working with the PCT and have been doing so for the last 5 years in commissioning. So it is a hugely challenging process we go through, but we've got a good grounding from our mentoring within the PCT. So I think we're quietly optimistic, not over-optimistic, but quietly optimistic we can lead the way here. And I think I should really take stock and see why we've got here and echo much that has been said so far. Alan's mentioned that Salford PCT was second in the world-class commissioning scrutiny 2010. Andy's mentioned that we are in a very good financial situation. He didn't mention that we are a very small number of PCTs in Greater Manchester that's in that situation, so thanks for the dosh. But that doesn't happen by coincidence. It happens because of really good leadership. It happens because of dedicated, committed, highly talented teams of people working within the PCT. It happens because of relationships they've built with each other, with colleagues like me, and with partner organisations. It is inconceivable to me that Hamish Health Salford would be where it is without the work that's happened in Salford. and it is inconceivable to me that we can go forward and do all that we need to do without a large tranche of those very people still being with us. So that was my digression, I suppose. One of the last points from the authorisation, partner organisations will be able to scrutinise how well we're doing. So soon that her colleagues in the council think I'm not up to it, they will have to say so, and they should say so. But if they do say we're okay, we might get the green light with authorisation. So there is quite a good check there.